My name's Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora Clinics. Now in this short video I'm just giving you a little bit of background about facial liposuction. I'm going to be talking about what's involved, who would be suitable and which areas can be treated. So facial liposuction is really like liposuction in any other area. Basically the fat is removed by sucking it out with very small cannulas after fluid's been injected to help dissolve the fatty tissue and make it easier to remove. The fluid also acts to reduce bruising and swelling after the surgery by causing constriction in the blood vessels. So which areas can be treated? Well, the most common area is really the neck, so it's the central area of the neck. The jowls can also be treated, and some surgeons treat along the jawline, and some venture into the upper face, particularly the cheeks, to remove fatty tissue from that area. The most commonly treated area is really the neck, and often liposuction is performed in the neck, either on its own or in conjunction with a facelift procedure, maybe a mini facelift procedure, and we've got number of videos discussing the pros and cons of these mini facelift procedures, which are available on the Aurora website. So with facial liposuction, as opposed to liposuction in other areas of the body, there's much less fat, and so traditionally less fat is removed. So you can make really very dramatic improvements to the neck and to the jowls by removing 4 or 5 mils of fat. And interestingly, often we will use the fatty tissue removed to build up other areas. So we might want to remove fatty tissue from the neck, from the jowls, but we might need more fatty tissue, more substance in the lines coming down from the side of the nose to try and build that area up. The other main difference is we tend to use very fine cannulas, so very thin cannulas to remove the fat in the face. It's a much more delicate area, and so we tend to use much finer, thinner cannulas to remove the fat from this area. So facial liposuction is a very successful procedure for lower face, jowls, and sometimes the mid-facial areas. For the neck, normally 1 or 2 small incisions just in the fold underneath the chin here is enough to access the neck and to remove any fatty tissue in the area. Similar incisions along the jawline can be used for the jowls, and these incisions can also be used for the mid-face. And again, some of this fat can be reused and injected in other areas of the face where you might need it. I think overall the technique is very successful. If you do feel you would benefit from facial liposuction, or like to talk it through, you can send us your photos and we'll give you our honest opinion as to whether this treatment might be appropriate for you. You can send your photos or email us at info@aurora-clinics.co.uk. If you'd like to schedule a free consultation with one of our specialists, please do so by filling in the contact form, emailing us or phoning us on our main office number. So thank you very much for watching the video. I hope I've given you some insight into what's involved in facial liposuction. Again, thank you for watching, and I hope you'll be able to watch other videos on our website.